you're all experts on childcare. I could ask any of the three of you to discuss any of the issues we're talking about here, and you all know each other, which is a good bonus for us. But we've tried to slice the childcare issue into three components. And we're going to turn it over to Linda Smith of the Bipartisan Policy Center first. And Linda's going to give us an overview of the program of the childcare industry, and also talk about some of the Bipartisan Policy Center's survey work on the topic. So Linda, welcome. And so get yourself unmuted, and we're looking forward to hearing from you.
Okay, so let's get going. And Chris, I want to thank you and the National Press Foundation for inviting me to be a part of this, and also to elevating the issue, because it's an issue that's very important to families in this country, to businesses, and to us getting back on our feet after COVID. So thank you for having this. Appreciate it very much. Next slide. What I'm going to do today, and I promised Chris I would be quick on this because we have a number of slides, but I do want to make sure that people understand the nature of childcare in this country. Oftentimes people equate childcare with education, and there couldn't be two more different, basically operating mode of operandi, I guess I should say. Because when the COVID hit a few months ago, schools closed, the teachers still got paid, the rent got paid, the utilities stayed on, etc. When COVID hit and childcare closed, the workers were out of pay, the programs were closing, and we had a real mess on our hands. So what COVID has done is really exposed what I would say, what a lot of us in the field knew from the very beginning. So this is just an overview of childcare in the country. There are roughly 675,000 childcare businesses. They are businesses, mostly for profit, mostly women-owned, and mostly small businesses, with 50% of all childcare centers serving fewer than 50 children. They are very labor intensive, with about 75 to 80% of the operating costs tied up in the labor costs. And over the side, as you can see, about 2/3 of all children in this country under the age of 6 have all available parents in the workforce. So that means we have a lot of children who need care, and we have a serious issue about the availability of that care. You see on there where the annual revenue in these programs, $47.2 billion a year, roughly, with most of that money coming from public subsidy vouchers, and Hannah is going to talk to you about those, and or private pay from the parents in the form of their childcare fees that they pay weekly or monthly. So my point on this, though, is it's important for people to know that as a business, with any business in this country, there is both a supply and a demand side of the equation. So we go to the next slide here. We know that the cost of care in terms of for parents is high and varies widely in this country. As you see, the roughly on average 18% of a family's budget goes to childcare, which is not an insignificant amount of their annual revenue or their annual income. There's wide variation in what is charged in terms of fees for childcare. And if you look at this slide, infant care obviously in this country has been a crisis for many years now. And because the cost to produce it is high. So the average ranges from $5,800 in Mississippi to roughly $24,000 here in the District of Columbia. That is a lot of money. And as we get into looking at the wages of the people working in it, it's actually more money than they make for most of our workforce. So there's a big variation. That variation holds for 4-year-olds as well, looking at the range there from $4,500 to roughly $19,000 a year. And then, as we said, and Hannah's going to get into this, but one of the biggest drivers of the child care market is the money put into it by the federal subsidy program, which she'll talk to you about in greater detail. Next slide. So what I wanted to talk to you a little bit about is, sort of just an overview of what it's costing us. If you look at the cost, as we said, it's mostly in the workers. The childcare businesses employ roughly 2 million workers in this country. They are split fairly evenly between center-based programs and family childcare homes. I think one thing that gets lost on the public is the fact that this is a fairly educated workforce. When you look at the numbers, 52% have an AA degree or higher, and they are over 90% female. That said, they are making pitifully poor wages at around $11 to $12 an hour. And it's worth noting that most lack healthcare benefits themselves, which became an issue during the recent COVID experiences. And about half of them are on some kind of public assistance program, such as SNAP, food stamps, and some of those programs. Yet they, like many other low-wage workers, were still considered essential workers during the COVID experience recently. So move to next slide, please. So what I want to just talk about is for people to really consider that when it costs more, the basic premise of childcare, which I keep trying to explain to people, is that with any business, when it costs more to produce a product than the customer can afford to pay, we have a broken business model, and it is failing our families and our communities. So let's go to the next one. So we've learned a lot about this. And so now let's look at the demand side, which is really the demand is the parents and their ability to pay. And the costs for most parents exceeds what they can afford to pay. And that is especially true for infant care. Any change in the demand by parents on these programs can have a serious impact on their ability to stay in business. So in most cases, parents' work hours can change, their preferences change for type of care, their ability to pay can change. And anytime one of these things happens and they take their child out of care, then the revenue going into the program goes down and it becomes less able to stay in business and produce the kind of quality we want. That said, the other impact of that is directors of these programs are reluctant to raise the wages of the teachers because they fear they're going to lose the revenue that they need to cover those expenses. So let's look at the supply side now, moving to the next slide. As I said, we have a failing business model, and this shows you the decline in the care over the last probably 15 years. Most importantly, we've seen a huge decline in the number of family childcare homes. What that means, though, is that is the care that where we see a lot of our infants in this type of care. We see a lot of family childcare in rural areas, and certainly this kind of care picks up the slack for the non-traditional hours care for many families in our country. So this has been a concern to a lot of us lately, and we're trying to figure out now how we can support family childcare providers and keeping them stable over the next several years. Going to the next slide. So we have a failing business model, and it's just really pretty simple in that the income and the expenses are unpredictable. And that causes for a lot of things to happen. But what most notably happened during the recent COVID experience is these programs, because the budgets are so tight, have very little in terms of reserve. And most programs reported to us, I think, that they could stay alive literally for 2 to 4 weeks on the reserve that they have. They're that fragile. So some of the other factors have to do with the ratios of children. And I put this out there because I think a lot of people don't understand that the impact of public pre-K, while we all support pre-K in terms of the public sector picking up the expense, when we take the 4-year-olds out of our childcare programs, that forces more of the cost to operate these programs down on the infant care, and that is forcing the cost of infant care up in this country. So as I said on the side, it's like squeezing a balloon. When you squeeze the balloon, there's only so much money and something is going to pop out. So we have often conversations, and we're going to talk about this, about the issues around raising teacher pay. Well, if you raise the teacher pay, you have to raise the parents' fees because there's nowhere else to go for this. So this creates a very unstable business model that we're all struggling to deal with. So now let's look at what happened with COVID. And as we all know on this call, or at least on this panel, what COVID exposed is something we all knew, and that these programs were very fragile and had very little operating cash. And what happened was the result was the loss of a lot of our capacity. I think we need to go to the next slide if we can. There we go. So what happened is that the supply decreased dramatically. We saw a loss in programs. Still, as of August, in our last survey, 41% of the childcare programs in the country were still closed, and we have lost about 14% of our centers reported they are permanently closed. So we're already starting to see a collapse of the market here. And then another 30% of the programs are operating with reduced hours and reduced capacity based on limited ratios now imposed by the states and other things that are going on out there. So in every equation, there's both a supply and the demand side, and the demand side is also going down in part because of parents' fear about what's happening. So our latest survey showed that parents do not plan to send their children back to childcare anytime soon, that they're waiting for schools to reopen, for a vaccine to happen. And for some, it's their own program is still not open. They're in the 31% or the 41% of programs still closed. So we have a really, we're struggling right now with the childcare community to keep enough children going into programs as they reopen to keep them viable over the next 6 to 8 months. And I'm sure we're going to talk about that in a little while about what are we proposing and what do we need to do that. So next slide. Still, as we said, parents still need work. I mean, or need childcare in order to go to work. And our latest survey showed that 44% still can't go to work without some kind of childcare. And so this is especially important, and it's very much of a problem for those parents who make less than $50,000 a year, because it's very hard to find, in the best of times, to find childcare, let alone with a limited capacity and so many programs closed. So parents with a limited amount of money to spend are particularly in a bind. And now we have a new and added wrinkle, and that is the pressure on families who expected their children to be in school in August and September. Those children are not in school, with so many of the programs now operating on a virtual or a part-time schedule. Those children also need care, and they have been thrown into this situation in terms of the lack of care available. So next slide. So I think what we're learning, what COVID has really shown us, as I said, is that a market approach to childcare simply does not work for childcare. And I think we're going to get into this public good aspect of it in this conversation, I hope. But what we have learned from this is that the margins are too thin for these businesses to stay open, that we're going to have to figure out how to keep them open for the next probably almost year, I would project, and I'd be interested in my colleagues what they think. But probably until about this time next year, families are going to be, in a different place when it comes to needing care. So what are we going to do to keep the childcare business viable as we move through the next 6 to 8 months? And I think we're going to have to think about that. But as the bottom line here is that we need to figure out in this country what the public good aspect is of childcare and who's going to pay for that, because we cannot pass that on to parents. They simply cannot pay any more than they already are. So to the last slide, please. So I think what we are trying to do, all of us working on this issue, is to figure out how we're going to address this gap between what it costs to produce a reasonable quality care for our children, and at the same time pay the people who work in these programs more than poverty level wages. It's a sin in our country that our childcare teachers are on food stamps. And so with that, I'll close and turn it over to the next speaker. Thank you.
Okay, well, Linda, if I could just ask one question while we're transitioning here. You do have a slide in there that talks about the supply of facilities, and the drop is driven by small family child care in homes. I mean, what are the reasons for that? I mean, that was a fairly dramatic decline in the other two, centers and large. Second group was centers, and what was the third group?
Well, there's basically two groups, but the centers, and then there's small and large family childcare homes is what you're seeing on that chart, okay? The family childcare is a complicated issue, and I think it, you know, from my experience with it, it's a combination of things. It's really hard to make a living at it, number one. The family childcare providers work very long hours. Generally, they're working 12 to 14 hours a day by themselves with about 6 kids, maybe more than that. So it's hard work, and there's not a lot of relief. The people doing family childcare have been aging in this country. It has been an aging workforce, and they're retiring out of it. And so we're seeing a little bit of that happen. Then when the economy picks up and you can make $15 an hour at a fast food restaurant versus 10 or 12, you know, in a home, think about that. For you get more money for a lot less work. So there's a combination of things going on in this, and they get very little support, to be honest with you. Most of them are out there in neighborhoods by themselves with not a lot of support.